So what we do know that can affect the implantation rate or the outcomes of ART techniques is the body mass index. In obese patients, we know that it can have an impact on the implantation rate and lower ALT implantation rates, or it could have an impact on miscarriage rates. It's also very important to try to control the body mass index during the pregnancy, actually, to avoid risks that could be related with our weight. And on the other hand, it's also important to try to control it for the delivery, because it's also implicated in high-risk deliveries. So that would be the first point of all that. On the other hand, we always recommend to change habits before the preparation, so to try to have a healthy lifestyle, try to avoid sedentary life, but all this before, a little bit before. Changing habits is good, because actually you will be following this during pregnancy. In terms of exercising, it's also important to do a little bit of exercise. It's not necessary to do an extenuating exercise, very intensive or things like that, but try to avoid sedentary life. And also because exercise can help to manage stress, which actually we don't know if it is related with lower implantation rates. It's not demonstrated actually, but we know that actually people that are doing ART techniques have a lot of stress, and exercise can help them to manage all this stress that they have. And on the other hand, if you have a medical condition, so if you have a medical problem, for sure it's very important to have it under control before becoming pregnant or before the embryo transfer. It's very, very important. And also because if you're taking some medications, probably you will need some changes in medication before pregnancy, or at least in the beginning of the pregnancy. And at last, it's also important to take in consideration the TSH levels and vitamin D levels that could have an impact on the outcomes. It's something that we normally look at. And if it's necessary, we give some supplements.